Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Foodborne illness. Introduction. Millions of people get sick from contaminated food each year. Foodborne illnesses are infections of the stomach or intestines. They are caused by eating food that has been contaminated. Symptoms may be mild or severe. Foods may have some bacteria on them when you buy them, but contamination can also happen in your kitchen. Handling food safely can help prevent foodborne illness. This program explains foodborne illness. It covers the cause, symptoms, diagnosis, and treatment of foodborne illness. A special section on how to prevent foodborne illness is also included. Foodborne illness. Foodborne illness happens when a person gets sick from eating or drinking contaminated foods or beverages. It is sometimes called food poisoning. More than 250 different foodborne diseases are known. Most of these diseases are infections. They are caused by a variety of bacteria, viruses, and other harmful germs that can be foodborne. Many of these germs spread in more than one way. Healthcare providers do not always know that a disease is foodborne. Foodborne illness is common, but it can be prevented. Cooking and handling food safely can prevent many foodborne illnesses. Causes. Most foodborne illnesses are caused by harmful bacteria. These bacteria can cause infections of the stomach and intestines. Other causes include viruses and parasites. Foodborne illnesses may even be caused by certain chemicals. Some harmful bacteria may already be in foods when they are purchased. Bacteria can contaminate food at any time during growth, harvesting or slaughter, processing, storing, shipping. Raw foods often contain bacteria that can cause foodborne illnesses. Some examples are eggs, fish and shellfish, fresh fruits and vegetables, meat or poultry, unpasteurized milk and dairy products. Foods can also become contaminated with bacteria when the food is being prepared. This can happen in a restaurant or home kitchen if food is not kept hot enough or cold enough. Food preparers do not thoroughly wash their hands. Utensils, cutting boards, and other surfaces are not properly washed after touching raw foods. Viruses can pass from person to person. They may be found in the stool or vomit of infected people. People who are infected with a virus can contaminate foods and drinks. This can be prevented if they wash their hands thoroughly after they use the bathroom. People may also become infected with a virus if they eat fruits or vegetables that have been exposed to contaminated water, shellfish from contaminated water. Parasites can also spread if food preparers are infected and do not wash their hands after using the bathroom. A person can also get infected with a parasite if they eat raw or undercooked pork or wild game, consume food or water contaminated by the stool of infected people or animals. Harmful chemicals that cause illness may contaminate some foods, such as certain types of wild mushrooms, fish or shellfish that have toxins in their bodies, unwashed fruits or vegetables that have been exposed to pesticides. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Symptoms of foodborne illnesses can vary. This depends on the cause of the illness. Common symptoms of many foodborne illnesses are abdominal pain, chills, diarrhea that may be bloody, fever, vomiting. Certain types of bacteria and chemicals can affect the nervous system. This can cause other symptoms such as blurred vision, dizziness, headache, paralysis, tingling or numbness of the skin, weakness, Symptoms can range from mild to serious. Symptoms can also last from a few hours to several days. Sometimes foodborne illness can lead to a loss of too much water from the body. This is called dehydration. Symptoms can include dark-colored urine, dizziness, excessive thirst, infrequent urination. Babies and young children who are dehydrated may have a dry mouth and tongue, high fever, lack of tears when crying, no wet diapers for 3 hours or more, sunken eyes, cheeks, or soft spot in the skull, unusually cranky or drowsy behavior. Babies, children, and older adults have the greatest risk of becoming dehydrated. People with weak immune systems are also at risk. Call a healthcare provider if you or a loved one has the symptoms of dehydration. Diagnosis. A healthcare provider will begin by asking about your medical history. This includes recent foods or beverages you have consumed. This can tell the healthcare provider if you are at risk for a foodborne illness. Your healthcare provider will also ask about your symptoms. He or she will perform a physical exam. Tests used to diagnose foodborne illnesses may include a stool culture. For this test, a sample of stool is collected. It is then tested in a lab for signs of infection or disease. Other samples may also be collected and tested. These include a sample of vomit or a sample of the contaminated food if available. Additional tests may be done to rule out other possible causes of your symptoms. If symptoms are mild and do not last long, tests may not be needed. Treatment. The only treatment needed for most foodborne illnesses is replacing lost fluids and electrolytes. This helps to prevent dehydration. Over-the-counter medicines may help stop diarrhea in adults, but people with bloody diarrhea should not use these medicines. Bloody diarrhea is a sign of a bacterial or parasitic infection. Over-the-counter medicines may make the problem worse in these cases. Medicines to treat diarrhea in adults can be dangerous for babies and children. Do not give these medicines to your child unless a healthcare provider has told you to. If the specific cause of the foodborne illness is diagnosed, a healthcare provider may prescribe medicines to treat the illness. For example, a bacterial foodborne illness may be treated with antibiotics. You can help relieve the symptoms of foodborne illnesses and prevent dehydration. Adults should drink plenty of liquids such as fruit juices, sports drinks, caffeine-free soft drinks, and broths. These liquids replace fluids and electrolytes. Sip small amounts of clear liquids or suck on ice chips if you are vomiting. Adults can also slowly reintroduce food. Start with bland, easy-to-digest foods. Some examples of these foods are rice, toast or bread, cereal, lean meat, applesauce, and bananas. Avoid fatty or sugary foods and dairy products. Also avoid caffeine and alcohol until you are better. You can help prevent dehydration in babies and children. Take the following steps. Give oral rehydration solutions to prevent dehydration. Give food as soon as the child is hungry. Give babies breast milk or full-strength formula as usual, along with oral rehydration solutions. Older adults and adults with weak immune systems should also drink oral rehydration solutions to prevent dehydration. Prevention. Foodborne illnesses can be prevented by properly storing, cooking, cleaning, and handling foods. This section provides information on safely handling foods to prevent foodborne illnesses. Refrigerate or freeze raw and uncooked perishable foods right away. If perishable foods stand at room temperature for more than 2 hours, they may not be safe to eat. Cook foods long enough and at a high enough temperature to kill bacteria that cause illnesses. A meat thermometer should be used to ensure foods are cooked to the appropriate temperature. Cold foods should be kept cold and hot foods should be kept hot. Wash fruits and vegetables under running water just before eating, cutting, or cooking. A produce brush can be used under running water to clean fruits and vegetables with firm skin. Keep raw meat, poultry, seafood, and their juices away from other foods. Wash your hands for at least 20 seconds with warm, soapy water before and after handling raw meat, poultry, fish, shellfish, produce, or eggs. Also, wash your hands after using the bathroom, changing diapers, or touching animals. Wash utensils and surfaces with hot, soapy water before and after they are used to prepare food. You can also sanitize utensils and surfaces with a solution of 1 teaspoon bleach in 1 quart of hot water.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Each year, millions of people get sick from contaminated food. Foodborne illnesses are infections or irritations of the stomach or intestines caused by contaminated food. More than 250 different foodborne diseases are known. Most of these diseases are infections. They are caused by a variety of bacteria, viruses, and other harmful germs that can be foodborne. Most foodborne illnesses are caused by harmful bacteria. These bacteria can cause infections of the stomach and intestines. The only treatment needed for most foodborne illnesses is replacing lost fluid and electrolytes. This helps to prevent dehydration. Other treatments are also available depending on the cause. These include over-the-counter medicines or antibiotics. Although common, foodborne illnesses can be prevented. It is always important to properly store, cook, clean, and handle foods. Talk to your healthcare provider for more information.
Thank you for using Explain.